Are you also trying to get pregnant but can't succeed? There might be a few reasons why you are not getting pregnant. Hello and welcome to India Top Doctor. Today we are going to have a little conversation with Dr. Runa Acharya. She is a distinguished medical professional with her expertise in IVF and infertility, obstetrics and gynecology. She is currently working as a Senior Consultant Fertility Solution at Medicover Fertility, Hyderabad.
One of the most important things a woman should be having good to have an easy reproductive career or easy way to conceive is regular menstrual cycles and healthy body and a healthy mental and a physical well-being. So menstrual cycles sometimes we say is a reflection of a woman's physical and mental well-being. So majority of the times, if there is any problem to a woman's health, it gets reflected in her menstrual cycles. So I think the most important point would be regular, healthy menstrual cycles, which we say should be every monthly, the duration of say 3 to 4 days to 5 days, and an average amount of good bleeding. Even if there is pain, there should be, it would be there on the first or the second day, a little mild and a little crampy, which is called as a physiological, and that's called as a dysmenorrhea. Anything apart from this should be, consulted, should be, seen with caution, and the lady should go and meet doctor and evaluate herself. There could be thyroid, diabetes, which may interfere with pregnancy or release of the egg or the baby to get implanted. So there are certain things which happen with some endocrinological disorders, like thyroid being one of them, the prolactin disorders. Even to that extent, even if there's a hemoglobin is less, that could be one of the reasons that the oocyte nutrition or the quality may not be good. So some of the things do, sometimes it could be, one of the most important is age. So as the woman ages, the eggs start falling down and more pronounced after the age of 35, but of late we are finding it after the age of 30. So these parameters is, I'm talking about the woman. And for a woman to get pregnant, definitely the husband's sperm matters equally. That is, I would say 50%. So male factor also is very important to be understood, evaluated from the sexual functioning to proper semen testing. These are all very important things for a woman to get pregnant easily. So if all is normal, these are the very minimum or the basic requirements for a woman to become pregnant. And apart from there, we look at the tubal functioning. So tubal tests should be normal, but that's all when we start evaluating. But presuming all is normal, she should be able to conceive easily. So it's first of all, it's very important for a couple to understand that what is a fertile period. So I usually, when women come to us, a couple comes to us for preconceptional or premarital counseling, we first educate them that the way first try for pregnancies have a regular unprotected intercourse during the fertile period. So in a woman who has to say 28 to 38 day cycle, the fertile period would somewhere be around say 14, 15, 16 day would be the ovulation. So start intercourse some 4-5 days before. So we can say that from the 10th to 20th, very easy to remember, the middle 10 days could be the more fertile period, and that's when they should have regular unprotected intercourse. And this they do try for say 6 months to 1 year in younger women. In case of women more than 30, 35 years, they need to try for say 6 months and then meet the gynecologist or the fertility specialist. For younger women, they can wait till 1 year. If they're very apprehensive, they can get the routine basic testing done. And if all's good, they can again wait for another say 6 months and then visit the doctor. So this is very important for them first to understand what is the fertile period and try properly. So it's not one day. It is, I usually advise them to have alternate day in the fertile period. The most important determinant in defining or giving a prognostication for infertility is age. So it's the most important parameter considered, and that's, we call it as a chronological and a biological age. So if a woman is at 20, 22 or 25, has a far better chances to get pregnant when compared to women more than 35. And that is why we always tell women that you have to plan pregnancy if possible before the age of 30, and that's the best time to become pregnant, have a safe motherhood too. And younger women have less complications. They have less chances of medical or disorders complicating pregnancy, like blood pressure, sugar, and they can take pregnancy more easily because they're younger. So the younger age, they are more better off handling pregnancy also. So age is definitely very important, and aging cannot be reversed. You can make a difference of say 10 to 20%, but you cannot change the entire aging of a 35-year-old to say 25 or 28-year-old. See, for getting a pregnancy, the most important, yes, ovulation is the first step. The sperms reaching the right time intercourse, or the right time sperms getting into the uterine cavity, and from there into the fallopian tube. The ovulation is a sign which says that the follicle or the egg containing follicle or a water filled bubble which has the egg in it, it's released. So this egg has to be caught by the fallopian tubes. The sperm has to reach there. They have to fertilize. The sperm has to fertilize the egg. The egg has to form an embryo, which takes around, say, 1 day after fertilization, then again cleavage, and finally to one of the best embryo, which is a blastocyst on day 5. And then this is the time when it comes and sticks. So you imagine ovulation is the first step, and there are many more steps to go from there. So the functioning of fallopian tube, which should be structurally, functionally both patent. The egg should be caught by the fallopian tube. Is usually very important that the ovary is near the fallopian tube. So, anatomy is very important. Then the egg and the sperm have to meet, and that has to be in that stipulated time. They have to form an embryo. The tubes have a functional motility which pushes the embryo back to the cavity. That has to happen well. The uterus lining should be ready at that time. So there has to be a very good synchrony between the egg release and the uterine lining. This has to accept the pregnancy. The pregnancy has to go sit. And that's somewhere a chance that the uterus lining, endometrium, accepts the embryo, and the embryo accepts the endometrium, and that's when a pregnancy happens. So there are so many things other than ovulation to understand about. Apart from this, there is a genetic composition of the egg, the genetic composition of the sperm, which again determines the quality of the embryo. So a lot of things are there to define infertility or tell that these could be the causes for not conceiving. Some of them we can understand, we can record them, we can explain them. Some of them we cannot explain, and some of them are beyond understanding of science. So we can only and try to understand, fix things which are easily diagnosed and treated. So see, the natural mechanisms what you're talking about is when a couple meets through an intercourse and has a pregnancy, is what is called as a natural pregnancy or spontaneous pregnancy. When it doesn't happen, we give them some medicines, we monitor the cycles, that yes, the eggs are growing, they're synchronous with the endometrium, the egg is releasing, that's it. And you have, we will tell them to have intercourse. And this gives you have a chance of say 5-10% per cycle. So when things don't happen naturally, we try to give them sort of an ovulation induction and try naturally. There's also natural trying in the fertility treatment also. If it doesn't work, and if the tubes are normal, sperm sample, everything is normal, they should usually work out at least in, say, over the period of 4 months, 5 months of this treatment. Usually 40-50% will get pregnant and go away. And if they don't, then we step up to the next level, that is IUI. So what we do is we bypass the cervix. So there could be some antibodies, some barriers, the position of cervix may not be good, the sperm deposition may not be good, the sperm may be having a more of mucus, may not be liquefying well because the vaginal fluid or the atmosphere is not good. So what we do is we wash the sperms, we make them only take the motile sperms and we put it inside. So this is called as IUI, where is intrauterine insemination. This is an artificial technology to put the sperms into the uterine cavity, but the pregnancy is natural. The sperms go to the tube, go into the tube, they reach the egg, they fertilize the egg embryo forms, comes back. Everything is just natural. The only way it is an artificial insemination. And if this doesn't work, there is the advanced artificial reproductive technology where we call it as an IVF or ICSI. So this is a technology where we bypass the entire thing which happens inside the body in vivo and we make it in vitro, that is in the lab. So we take out the eggs through the ultrasound guided technique. We grow the eggs, not in one, multiples, whatever is available for that entire month. We take the eggs out, we fertilize them with injecting the sperm into the egg by ICSI or keeping the sperm next to the egg, millions of sperms next to the egg in the petri dishes. The embryo which is formed out of the IVF or the ICSI is transferred back into the uterine cavity, either in the same cycle or in the next cycle, so subsequent cycle. So this is basically an artificial reproductive technology totally, because everything has handled in the labs by the clinicians and the embryologist. So this is one of the ways a woman who is not getting pregnant naturally, who doesn't have tubes, who has count is less, or there are many more reasons where women have to be offered IVF ICSI treatments. And this is one way aids the success rate of a cycle to be around 40, 50, 60% sometimes, depending upon the cause of infertility. And usually majority of them conceive in the IVF ICSI cycles. And if they don't have eggs, they don't have sperms, then there is always third party. They don't have a good uterus. There's always a third party reproduction to help these people have their own baby or have a baby in their own womb. It's actually a myth, because contraceptive pills are one of our main treatment protocols when we don't get a good cycle. So we suppress them, and the yield in the next cycles is found to be better when we have women with a lot of hormonal imbalance who are resistant to our treatment. So this is something called as a suppression. So when we use it, we feel that the cycle, the rhythm of the body or the circadian rhythm is set. So woman gets periods regularly. And once she stops the pills, there is ovulation, a good ovulation in the next few cycles. So women especially, I would not say this would work for a normal cycle, a lady with a normal menstrual cycles. This works very well for women with PCO or hormonal imbalance, where their own hormones don't allow them to have a good egg quality and good release. So in such cases, the contraceptive pills do wonders. So usually when they come to us for preconception counseling, especially the PCO with very irregular cycles or irregular menstrual bleeding pattern, so we put them on contraceptive pills and it works. And then when we say them that when you are planning to get married, stop them, so that as soon as you get married, there's always a chance that you would have sudden good ovulatory cycles and you will conceive easily. Getting pregnant is a desire of every couple who looks at, from the family point of view. It's a social, it's not a couple, baby is not for only the couple, it's for the family, and it hence becomes a lot of social issues. I agree, everything is important in life, career and self-empowerment, everything. But for women, my advice is that take care of your reproductive health from the very beginning. So the mother should be taking care of the daughter's adolescent reproductive health, that is the menstrual cycles, keeping a watch on them, getting them right, giving them good advice about the diet, the lifestyle, the exercises. So keeping one's reproductive health as good as possible from the very beginning, that is from menarche, and trying to get pregnant within, I mean, have your pregnancy within the age of 30 is one of the very important factors to have a healthy pregnancy and healthy baby. So I always feel that a woman should complete her pregnancy and her childbearing before the age of 30. So we have to plan our lives, our careers and all accordingly. And I think that's very important need of the hour, looking at the increase in the fertility issues these days.